Pfizer is the world's leading research-based pharmaceutical company. That means it's utterly crucial for Pfizer to understand where healthcare is headed in the coming years. It means we have a lot to learn from Pfizer. Our next speaker, Cavan Redmond, is just the right individual to share meaningful insights. A member of Pfizer's executive leadership team, he leads efforts focused on enterprise-wide strategy, portfolio management and analysis, and continuing improvement. He's also responsible for 3 of Pfizer's key businesses. Needless to say, we're very grateful he's taken the time to be with us today. Please help me welcome Cavan Redmond. Cavan.
Good morning. So let me first thank the university for giving us all a chance to meet with you today and talk about healthcare. And I think when I take a look at what all 3 of us are trying to do in terms of the discussions today, we're going to give you different views of healthcare, and part of your opportunity is to put those views together and see where the world is going. Part of what I'll talk about is much less on what companies are doing as much as where the world's going, and really focusing on the US and some major changes. But I'd probably start with this. There's probably no better time and no greater opportunity to be in healthcare than today. The business opportunities, the chance to impact patients' lives and to change entire structures of healthcare is greater now than it's been at any point since the 1960s. We have an opportunity because of the tremendous amount of national dialogue in this area to make changes, but at the same time to be able to impact the lives simultaneously. And in fact, when you take a look at almost all of the recent breakthroughs in terms of healthcare, they're related to when major legislative acts have occurred or major regulatory changes have occurred. If we were sitting here in the 1960s, we'd see that a new empowered FDA who's focusing on efficacy and benefits with a new focus on efficacy was coming out with new regs and new proposals to change. That began an era of new ways of looking at medicine, new ways of treating patients, and new ways of driving things through. We're sitting here in the 80s when there were new tools that became available for both physicians and for researchers. We saw a massive increase in drugs that were being able to be created throughout the 80s and the 90s that are here today and helping patients' lives all over the world. If we take a look at where we are today, there's no debate greater in the press and quite frankly on the Hill than what's happening in healthcare. And what's interesting is, I think David did a great job talking about what companies can do to impact innovation and change the way medicine is going. And I think that's critical. But there's another movement that's ongoing that's equally powerful and much quieter, and it happens every time there's asymmetry between what consumers want and what companies and healthcare systems and governments are trying to deliver. And what it is really a focus on where consumers are looking. Think about it this way. If you take one thing away from my presentation today, one of the things you have to remember is before somebody becomes a patient, they're a consumer. They're a mother, they're a daughter, they're a father, they're a son, they're the neighbor, or they're the business colleague. But above all, they're a consumer. Once they go into the healthcare system, that changes and they become a patient, but they still use the healthcare system as a consumer would. They're looking for efficiencies, they're looking for opportunities to learn, and they're looking to take control of what's being done to them so that they can have input and drive that through. And in fact, that's the single greatest opportunity that we have in healthcare in the United States today, which is what we see as a retailization of healthcare. And what does that mean and how does that feel? What you're seeing essentially is consumers are more and more asking why, what, when, how when it comes to healthcare. They're looking at control. They're looking at being able to not only get wellness, but also when they go into the healthcare system, being able to have the control of the information and the data they need. A simple example. If you're sitting here today, there's 3 numbers you could think about that are trends since 2005. 12,000, 15 million, and about 30 to 40%. Let me add some context to those. There are 12,000 healthcare clinics in retail settings in the United States right now, right? Not a great number. Some companies have committed to grow that significantly. Most of them at pharmacies, CVS, Walmart, or Walgreens, and things like that. Since 2005, they've seen 15 million patients. 30 to 40% of those patients had little or no primary health care insurance. Now you could say, it's a small trend, how valuable is that? I'll take that trend to the next step. Loyalty cards at major retail drugstores are becoming more and more important. What's interesting is a retail card can give you 40 to 50 million patients or consumers to sign up. Out of that 40 to 50, 50 to 60% of those will shop at that retail outlet every single week. What are they looking for? They're looking for answers. They're looking for integrated solutions. And what does that look like? Well, if you go down to Toms River in New Jersey, since it's not far from here, you'll see one retail store that has a concierge that when you walk in has an iPad and goes through all of the questions that you might have in terms of getting your prescription filled and what your dietary needs might be and other things that you might want to consider. So they're trying to make it personal. What is healthcare looking like? For that patient, it looks like a very personal experience. What else will it look like? It'll look very different than it does today. I want you to think about this in terms of related industry. If we were sitting here in the late 90s and you wanted to buy electronics, you had two major choices in the United States, especially on the East Coast. You had Circuit City and you had Best Buy. Does anybody remember either of them? Does anybody remember Circuit City? There was one change that Best Buy made. Actually, there were a couple of changes, some didn't work. One change Best Buy made that had a profound impact, and it started two things. It started the Geek Squad, and it started the Magnolia Center. Here's what it actually did. It essentially took a very complicated system that you were trying to do something at your home theaters and computers, and gave you assistance on how to create that experience in your home in one place. That's no different at all than what people are looking for from healthcare. They're expecting those of us in healthcare, whether you're a physician, whether you're a pharmacist, whether you're a distributor, or whether you're a discovery scientist, to come up with a solution that integrates it like they're used to. And technology exists today. David walked through some of what Medco is doing, which is truly cutting edge, but it's only part of the story. If you're a consumer, you want the whole story, and you want it to look very different. So let's talk about efficiencies, and let's talk about where the changes are going. Consumers have wanted changes in healthcare. They got it through the Healthcare Reform Act, which creates a tremendous amount of change. What they didn't get was accessible and easily understood healthcare. Where I think healthcare is going, quite frankly, is they want control of the data and control of the decision-making process so that they can integrate that into their lives in a different way. So what will healthcare look like in the next 5 to 10 years? Healthcare could look like this. I'm sitting at my computer. I've done my blood test. I've transmitted it through my wireless to a central place. I get onto the phone, or actually, in this case, onto the television screen, and talk to my doctor. I pay a set fee per minute, get his or her advice, and then I get a script and I go to my pharmacy. I either do it through mail order using the computer or actually physically walk there. You walk into the pharmacy. What that pharmacy will then provide you is advice on other things that you have to do, drugs and OTC medicines that you have to be careful of, all the way through to what else you should be thinking about in your dietary changes, and then you go home with a complete package. That exists in some part of our country today. And if you think about it, that's the most profound change that the Healthcare Reform Act and the healthcare debate has actually created. What it's created is new entrants into the space to focus on the consumer. And what will that look like for them? You're going to see a blending of your OTC medicines, of your diagnostics, of your prescription drugs, of what your physician provides and what your hospital provides, blended into one. And what they're looking for is the retailization of healthcare. They're looking for a place that I can go to be able to get all of my needs met that meet how I currently work, live, and think. And some of it I'll pay for out of my pocket, and some of it I won't. But what I want is it integrated together. So if you're looking at what it would look like, combination of a pharmacy, a hospital, throw in a little bit of Best Buy, and throw in an iPhone, and you've got probably what the future is going to look like in healthcare. So I can walk in and get what I need and walk out knowing where it's going to go. The other thing that consumers are looking for is how it's going to impact me individually. Right now, if you're sitting here and you're working for a telephone carrier or you're working for an internet company, there are lots of companies out there talking about creating databases in order to be able to capture healthcare information. In fact, what the consumer actually wants is all of that in their computer or on their chip or on their iPhone, and that they want control of that data. What they want to be able to do is cut the data 16 different ways and take a look at how that interacts with other information that's out there so that they can make better informed choices. They'll be willing to pay for it, and they'll be willing to also get it supplemented by some of the changes that are happening in healthcare. But essentially what you're going to see is a retailization of healthcare where you have a more integrated system and individuals are able to step back and have a total experience that matches what they're expecting. The other challenge is you're seeing a major change in the inventions that are coming into healthcare. So if you're a pharmaceutical company like Pfizer is and you're investing large amounts in R&D, that R&D engine is changing radically. And it's changing quickly because, one, where the governments are looking for us to do investments, but two, what consumers really want. And I'll pick up a little bit of what David said in his presentation. He talked about the power of the data and the power of essentially what's happened in the last 10 years. In the last 10 years, discovery level scientists have created a new vocabulary, new science, and new capabilities for companies. They've created a whole new way to look at drugs and drug development that'll take us another 10 years to be able to implement in its entirety into our R&D organization. But the one thing it's done that's given us incredible opportunity now as we sit here today is the ability to look at medicine differently and to make it not more personalized but more individualized. And how will that look in the future? We will have affordable health care in the United States, and drugs, which everybody focuses on, will also be affordable. It's a natural course of how the system works right now. I'll give you a great example. If you think about it today, and you think about it for last year, and you think about it for next year, the greatest number of drugs will go generic in our country's history over this period of time. In fact, when you take a look at it, just under 80% of all prescriptions will be, in volume, will be for generics. That's where essentially the bulk of prescriptions are coming from. What's interesting is, if you're an innovative pharmaceutical company, this is how fast it happens. 6 months after a drug goes generic, 80% of the volume, on average, moves over into a generic manufacturer or into the generic space. So that's creating a tremendous amount of change in the healthcare system. It's creating room, if you will, on the drug budgets throughout the economy. It's changing, if you will, the price point for drugs. And in fact, if you think about it, the average copay in the United States has gone down in the last year, and it's now at about $10.78. So all of those little indicators are showing that even on the drug side, things are changing. Here's the challenge. Now you've got to invent drugs that are more meaningful and that can be done in a way that actually helps to change the industry. So you have drugs that are actually looking for specific targets, using the genetic data that's available and using modern testing to be able to help essentially identify drugs, get them to the market faster, and hopefully impact patients in a much different way. So you're seeing a retooling of the pharmaceutical industry. You're seeing massive layoffs also as it resizes itself. And we're seeing a different way of looking at science in order to be able to develop those new drugs. But the other thing that's coming in that's identical to the retailization that I talked about that the consumer wants is you're getting more and more patient insights into what they're looking for and how they're looking to be treated. So if you're coming out with a new oncology drug, you're looking to be able to have specific tests that tell you whether or not you have a higher likelihood of being able to be affected by that drug. And that's being done in research labs throughout the country. You're also taking a look at, can I know more about the side effects, and can I understand more about the risk-benefit of those drugs? That's been done through how post-marketing surveillance studies and how databases are being created to look at the long-term impact of drugs and find out where that information can be most useful in order to develop the next set of drugs or to create the warnings or the benefits that are required for drugs. So those are movements that are happening as we speak, and over the next 10 years, we'll go from essentially a trough that's occurred in R&D in the last 10 years to essentially a boom of new drugs that'll come out, but they'll be much more specific, they'll be much more tailored to specific diseases, and they'll change the way medicine is practiced. But at the heart of it, the single biggest decision that has to be made is it the consumer who's going to make the decision, or is it going to be the healthcare system in terms of how they're going to be treated now and when these new medicines come out? My belief is there's going to be a second revolution in healthcare, and that is essentially going to be, there's going to be an Appleization of essentially healthcare. Think about it this way. There's an app for almost everything except for integrated healthcare. There's an app for being able to do almost anything you want except for combining your data, your disease, with your network of providers. That could be developed. You could actually have essentially integrated systems that could get us to essentially a point where consumers have a greater say in what they do, which is what they want. The science continues to move along and customize and provide more data, which is happening, and it can all happen where you want it, on your smartphone or on your computer. And that's the other trend that I believe that will occur over the next few years. So if you take what the pharmacy world is doing, which is one of the most wired areas of the healthcare system, and you're able to wire the diagnostic area and what your physician is doing, and you could control that data, people will then begin to make personal choices. So the national healthcare debate has upsides and downsides. It's causing a massive debate about new entrants into healthcare and seeing if we can simplify it and put the control back into consumers. You have new businesses being created and new opportunities, but you also have a consumer movement that's saying, I want more and more control because I don't understand all of these changes, but I do know this, I don't want to lose control of my health care. And finally, the other thought that I'd leave you with is this. When you wrap it all up and you think about what people are really looking for and what are they doing, their needs are changing. If you think about one of the changes in the Healthcare Reform Act is if you're under 26, you now have coverage. It's interesting when you survey that group and what coverage means to them versus somebody who's 50 or who's 60. To them, it means, so can I get the data online and can I make my own purchases? Can I do something that's similar to what I would do in my normal course, and why do I need all of these intermediaries to drive through the changes? If you're 50, if you're 60, if you're older, you're worried about, do I have enough coverage to cover chronic or catastrophic illness to be able to manage it? But all of them are looking for the data and the information that's capable of helping them make the decision. So when I take a look at the next 5 or 10 years, I think the most profound change that you're going to have is a combination of technology, so everything from video conferencing all the way through being able to do your diagnostic testing in your home and transmit it, to integrating physicians, pharmacists, nurses, and others in a retail type of setting or a computer type of setting that allows me to interact like I would for the rest of my consumer decisions, and, quite frankly, the integration of food, functional foods and others, prescription drugs, OTC medicines and others, so I can plan out my healthcare environment, so I can try to stay healthy, and then when I do need help, I can know what part has to change. All the tools are there, and over the next 5 or 10 years, somebody's going to figure out how to essentially retailize healthcare and at the same time create an app for that. And when it does happen, it'll be the most profound change in healthcare, because instead of consumers being passive, and that passivity can be seen as not taking your medicines, all the way to skipping your appointments, all the way through essentially ignoring things, they'll become active users of healthcare and demand more for a system that's capable of delivering more. So what does the next few years look like? It looks like there's going to be a profound change in terms of where healthcare is going to go and what healthcare is able to deliver. But I believe it's going to be driven as much by the consumer as it is by the medical establishment and by government. because the consumers don't like when there's asymmetry between what they want and what can get delivered. And that asymmetry has been no higher in our history in healthcare than it is today. So the technology is there, and what they really want is to be able to control it and to drive it through. And I think that that's going to be the single biggest change in healthcare, and also the single biggest driver as we move forward. So with that, let me end and see if I can answer any questions. Thank you very much.
Hi again. What role do you see the pharmaceutical companies playing in this new arrangement?
I see two areas where we can provide tremendous strength. One is in the science, and acting as an integrator of the science, so being able to take what's required essentially at the genomic level all the way through the diagnostic and the use level, and making that science much more accessible to the healthcare field so that they're able to actually make better decisions. And I also think that we have the opportunity to be able to combine our experience in areas like consumer healthcare, OTCs, and others, and essentially create and make that more accessible to the patients and healthcare providers so the decision making is easier. So I think the business model will change, how we do marketing and selling, and it'll become much more essentially being able to provide services and ideas that allow decisions to be made clear. And I think our science, which is really the engine that drives pharmaceutical companies, will become more accessible as we link into not just developing the drug, but developing the test and developing the processes and procedures that allow people to make better decisions in a faster period of time.
Hi, thank you. My question is very similar, so I'll actually take it one step further. One of the things that we're watching very closely is this kind of increased collaboration between payers and health plans and providers, right? They're purchasing provider groups, and then you have other organizations who are actually doing their own retrospective studies, basically having a point of view on the data around pharma's drugs. So in light of that, how do you think the business model can change maybe a little bit more specifically to now kind of be part of that collaboration and share information around how the drugs are used in clinical practice?
The amount of collaboration between pharmaceutical companies, payers, and academics has been on a significant upswing over the last several years, and I think that will continue. But I also think that you have a wealth of data that's now available on a regular basis that's allowing essentially a lot of those collaborations that you're mentioning to not only happen, but for the drug companies to be a significant part of that. So if you look at how drugs are researched today and then how quickly the data becomes available, that's the first sign that the system is beginning to change. The fact that you can collect data on hundreds, thousands, or millions of patients through all of the systems that were created in either the providers like a Medco or a CVS Caremark or others, and combine it with the basic research that are done in the labs and be able to look at that data and see trends, that's happening now. And I think that that's the good news. But I think the challenge is the volume of analysis that has to be done for drugs that have gone generic, plus the new drugs, and the ability to look at what does all of that mean to the individual patient. A lot of that work is still yet to come because the technology is relatively new and just now impacting each of those systems that you've just mentioned.
In other industries, one of the reasons that consumers are empowered is because they are directly the payer, and so the providers pay attention to them. How do you see consumer empowerment evolving in the current system where so much of the time, although we're the ultimate payer, so much of it is indirect through employers, through insurance premiums, through our taxes, and so therefore providers don't necessarily pay attention to consumers as much as they should because they're not the ones directly paying the bills?
One is payment, and your involvement in payment is an interesting, if you will, analysis. So under almost all of the scenarios that are going forward, the individual or their family is going to have some part of the health care bill. And as long as they have a stake in that, whether it's a 1% of the bill or whether it's a 20% of the bill, they believe they're paying for it. The second thing is, there's virtually not a person who's gone through the healthcare system that doesn't believe that essentially they have, if you will, a part of the skin in the game and have to deal with the cost of the healthcare system. So that in itself is going to create the tension for, I think, creating change in the healthcare system, and it's creating a voice. So if we look at it from a strictly, share of voice, so how much voice will they have? Patients are actually going to probably have the largest share of voice in the whole system, because they have a couple of things that companies don't have and the government doesn't have, which is they have the ability to vote, they have the ability to protest, they also have the ability to change by going somewhere else. So for example, in the healthcare reform, there are several things that have to happen in order for the economics of healthcare reform to work. The under 26 have to be users and at the right rate of healthcare, essentially consumption. There has to be a form of universal healthcare, or essentially broad healthcare, in order to fund essentially the different pools. If you don't include the consumer and what they want in the process, the economics of healthcare by the government or even by companies that are providing it won't work. So I think that at the crux of what you're trying to do with healthcare is still heavily reliant on consumer behavior or patient behavior and how they use the system. I also strongly believe that if you're going to be successful in healthcare, you've actually got to empower people to take use of wellness programs, because even though that won't eliminate the heavy users of the healthcare system, what it will do is change the profile of what a heavy user of healthcare systems are. So if you actually look at and step back and look at data across what consumers are looking at, the move in the grocery store to have functional foods, so essentially probiotics in yogurts, all the way through claims on what vegetables can do and making them more convenient and more consumable, are all part of a wellness movement, and those are the fastest growing parts of the store for food. If you look at OTC medicines, you still have, and we'll use the U.S. as an example, you'll still have 75 to 90 million people taking an Advil a year in order to manage their pain. And then on top of that, you have the change that we talked about earlier in the prescription side and how the healthcare system itself is changing. In order for healthcare to be successful, each of those pieces have to line up together, and there are companies, processes, and procedures that are, if you will, ripe for being able to integrate wellness with actual active care, and I think that that's where healthcare is going to go. The government will play a big role in essentially where they'll pay for things, but you've got to be able to create an environment where wellness is a strong part of that, and that's all self-pay no matter how you take a look at it.
The one aspect of healthcare that I haven't heard David or you speak about is the FDA. With complexity and technology obviously increasing, is the FDA up to the task? What's happening in pre-drug approval, phase 1, through phase 4? How is that affecting Pfizer's business? And are they up to the task over the course of the next several years to be able to continue marching along in terms of what's necessary for the end consumer?
So if you take a look at the FDA, they're going through the same retooling that healthcare is going through. So FDA responds to what, obviously, besides Congress wants, what consumers want, but they also are very focused, quite frankly, on also what science is allowing them to do and what science-based decisions are allowing. I think there's been a massive change over the last 8 to 10 years in the data you have available and the types of decisions that you can make, and equally important on low-level detections, whether it's in your food system, all the way through to your animals, all the way through to your drugs, that allow you to essentially look for low-level indication to see if there's something there. And that's why you see everything from food recalls all the way through to discussions on FDA on the drug side. My belief is that they are retooling, that they're bringing new resources in, new science, and new capabilities. Where there's a disconnect is how fast that can occur, which is a matter of time, money, and resources, and how fast science is changing, and how much essentially volume is now going through that agency. So a fully funded FDA, so if we skip all the debates in Congress right now about what gets funded and not, a fully funded FDA with the right resources should be a significant enabler to the American healthcare system, because they have essentially the keys to the car in order to be able to drive that. reduced funding or not being able to have significant funding to be able to meet that mandate, and they have to make choices. I believe they need a full funding mandate in order to meet what is essentially a critical role. If they have that, then drug approval timings all the way to the food safety or the animal safety becomes essentially an achievable goal, and you don't have to make the trade-offs. The other thing that I think has changed is, remember I said that I believe that we're going to go through essentially an increase in innovation in the pharmaceutical side in terms of drugs and technology that'll result in new medicines or new ways of treating patients. That upswing has to be essentially matched with where the FDA is putting its resources and its timing and its growth so that we grow essentially together in where that science is going. So I believe the FDA has the capability of doing that, but I think like the industry itself, it's looking at both its funding, its resources, and its mandates and making sure it has the resources to do that.
As I understood your discussion, information and information systems will enable consumers to drive their needs into the marketplace to get what they need done. But the obverse side of that coin is privacy. How do you see the tension playing out between consumers' needs, information systems, and privacy to get consumers where you expect them to get to?
What are you doing with the data and who has control of the data? So privacy becomes a real issue, and it's actually something that hits us not just in healthcare, but a lot of things in our lives right now, which is how much is available to everybody and how much is available to me. So for example, if I've got a network provider that provides me a way of being able to manage my healthcare, my wellness all the way through to my chronic needs, and I've got control of that data, that's a level of privacy, right? The problem is I need them to gain access to that database or that information in order to help me make better decisions. So by the very nature of that statement, that means that I'm going to extend my privacy rights over to those individuals. It quite frankly is no different than what Google, Facebook, and others are facing right now in terms of do they own the data or you own the data about you on their websites. So I think in the US in general, this whole concept of what is to be kept private and who owns it, where it's going, is going to be a raging debate for the next couple of years. When it comes to healthcare, I think that we have a system that enables us to be able to share data with the people who need to see the data in order to make decisions. We actually have a good system also of being able to take out personal data but still aggregate data to see if there's trends. And I think you need that in order to be able to have good healthcare systems, drug development, and to provide physicians with data. So I think the debate's going to rage on, but the practical implication is the more control or the more access to the data that you give the individual consumer or their families to be an active participant in the data collected on them or about them, the stronger the relationship between the healthcare profession and that individual is going to be, and a lot of those privacy issues can then be worked out through, essentially through that type of an opportunity. The challenge is that patients can't get access to their data in the way that they want it right now, and that's the biggest, if you will, technology piece that's missing, where I think the greatest breakthrough could occur in healthcare right now.
I'm Jean Barnett, a patient advocate, and I've been a patient advocate for 17 years, working with the cystic fibrosis community, and I've followed Dr. Tom Ferguson, who wrote the Bible on the e-patient, and he said that patients would treat their doctors as gods or as partners or as even just providers. Do you see, I see patients definitely treating their doctors as partners now, but do you see them treating them as providers? Like just providers for the medication, like I know which medicine is bad for my genetics, so therefore I'm gonna find the doctor that will give me the good medication.
So I think there's a challenge with that, right? So if you treat physicians as providers,
Right.
then you're missing the core of what they actually can provide to you in terms of healthcare. Because now essentially you have no point person, if you will, in order to be able to run your ideas and concepts through. Where I think the change is going to occur is that physicians will treat more of what you're trying to accomplish than simply brief interactions. And let me give you a simple example. If you're taking OTC medications, if you're changing your diet, and you're getting prescription drugs, and you have to go through other types of treatments, the ability to integrate all that and have a discussion is going to be critical in healthcare now and in the future, because your level as a consumer's knowledge of being able to ferret through all of that data is going to be very difficult. However, for physicians to be empowered and being able to essentially go through that massive information, they need different tools and resources, not only about what data is available about healthcare and the issues with a particular disease, they also need more information about you, and they've got to be able to very quickly, if you will, integrate that data so that they can have an educated discussion. And that's where I think that technology is going to have the greatest role, because as drugs become more complicated and as other treatment settings become more complicated, you need a way that essentially allows you to bridge that complication and have a direct discussion. I don't see the role of physicians becoming one of providers. I think that would be a very dangerous system for essentially assuring good medicine. But I do think that they will be essentially critical, as will pharmacists and other parts of healthcare. And what you'll have is essentially management teams, if you're looking at it from a consumer side, that you'll be able to tap into to help make the right decisions, and quite frankly, to make sure that you're moving your healthcare forward.
I just had a quick clarifying question, and then another question on top of that. So the one, I just wanted to understand what role pharmaceuticals would play in kind of developing those apps and dispersing the information. As you were saying, if they played a role at all, I wasn't sure if you're saying pharmaceuticals should play that role, or somebody or a middleman should play that role. And the other question I had was, if farmers were to become more consumer-centric, how would the business change from one that's typically more science-based to one that's more based on consumer needs, especially in terms of internal processes, things like that?
Let me take the first. When it comes to where pharmaceutical companies can interact in terms of, if you will, a potential consumer movement, think about it this way. The amount of work we do in research and development to understand everything from the behavior, so if we have a twice-a-day injection, is that really a viable drug, even if it provides great benefit, all the way through to how that particular drug will work within the individual patients, all the way through to, quite frankly, other information that has to be taken into account, is a critical role that pharmaceutical companies play now, and I strongly believe will continue to play. So they'll be a significant provider of essentially the critical information that's available. If you work with discovery scientists, what you realize is there's nobody who knows the molecule better than the individual discovery scientist, but what you actually need is, once the drug gets onto the market, you need the breadth of data that's available. That's where essentially our medical knowledge and capabilities, I think, become incredible enablers for understanding when you're seeing data or when you're seeing observations, what does it mean and how might that relate to the drug, or how might it relate to other things. So I think that'll be a continued very critical role for the pharmaceutical industry. And I also think that the ability, if you will, to leverage that scientific knowledge becomes incredibly important. In terms of bridging to, so we're science-based, for the pharmaceutical industry, we're a science-based, essentially, organization. What would you change in terms of processes, procedures, and things like that? Where I think that I've seen in the last 15 to 20 years of the industry, the greatest change in terms of our touch with consumers or our touch with physicians is making information more accessible and making it more available. And I believe that that's still a role, and a vital role, for the pharmaceutical industry, and will be a driver in our model. If we all were to sit here and think about it this way, technology in the early 1980s on computers and software were esoteric at best and difficult to use at the best of times. And now, as we sit here in 2011, the use of technology is essentially second nature to virtually everybody in this room. You don't think about it when you get a smartphone. You don't really think about it when you turn on your computer in terms of what to do with it. I think that seamless integration, pharmaceutical companies will continue to play a key role, because we can make science more accessible, and with other healthcare, essentially, companies and providers, we can make it so that people understand it in the language and the way that they need to. A great example is 15 years ago, package inserts for patients were almost unheard of and very difficult to read in some cases. Today, If you take a look at a patient package insert, it's a remarkably different piece of communication tool. And those are just simple examples of where healthcare is going and where pharmaceutical companies can play a role. So with that, thank you very much.
Thank you, Cavan.